Welcome to Business Innovators Radio, featuring industry influencers and trendsetters sharing proven strategies to help you build a better life right now.
Welcome to Brilliance Business TV, conversations with leading experts in business. I am your host, Mark Stephen Pooler. We have a wonderful guest today, Dr. Juanita Bukenya. I know a lot of women out there, when they get menopausal, it can cause all sorts of problems. So we're going to have a great conversation today. I just want to make an official shout out to our show sponsors, Dreamweaver Artist Ranch. We are streaming live on Facebook, Twitter, Instagram, LinkedIn, YouTube, and we're also streaming through mspnewsglobal.com. We're on the E360 TV network under Fresh Takes, going out to Apple TV, Fire TV, Android TV, Roku, and we're also on Business Innovators Radio Network. Let's bring in our incredible guest, Dr. Juanita Bukenya. Dr. Juanita, welcome to Brilliance Business TV.
Thank you for having me, and a Happy New Year to you.
A big Happy New Year to you. I hope 2022 has started off really, really brilliantly for you. Dr. Juanita, just share a little bit about your past and your background that has led you into the work that you are doing today.
Okay, thank you so much. So I'm a pharmacist by profession, and I actually worked a lot with in pediatric pharmacy. I grew up in Uganda and Kenya. That's where I came from, and I came to school in the United States. And I did all my pharmacy school here. And as I grew older, I realized women go through phases of life like anybody else. And when it came to time for me to go through, I don't like to use that word, but it's a change of life, they call it. But when that came about, it was really difficult. It still is. I'm still going through it. So, and it's something that all women have to go through. And I figured, I said, I need to figure out how to help myself go through this. And I did a lot of research, did a lot of studies, and also because of my medical background, it helped me a lot. And I said, I know I'm not the only one going through this. I'm not. And so I had friends ask me a lot of questions about this menopause journey. And I helped them out. And they said, well, why don't you help other women do this? You're actually pretty good at giving this information. I said, okay, well, why not? Why not? Because every woman is going to go through this one way or the other. And so I thought it'd probably be a good idea for me to be able to help the masses.
I love how you're really being of service, Juanita, and you had a great education. You have been really well educated.
Thank you.
I would just like to dig a little bit deeper into some of what does menopause look like? What age? I know it will vary, but what kind of age does it affect women, and what kind of symptoms? Because I know there are quite a lot of symptoms as well.
Yes. So menopause, just like you said, it starts at different ages for everybody, but usually it'll start around 35, which is really on the early side, and go all the way up to the women who are still in perimenopause at 55 years of age or 50 years of age. Yeah. So it really varies. And so those who start young, and I say young at 35, which is still young, some of them won't go into full-blown menopause until they're like 50. So that's 15 years of going through all those symptoms: hot flashes, sleeplessness, mood swings, low libido. It's just, you just don't know what's going on with your body, and it's so unnerving and annoying most of the times. And so all those symptoms can come up, and not everybody gets those symptoms. Some people have more hot flashes than others. Others have more sleeplessness. Others suffer more with moods, or some have all of them. Case in
Wow.
point. Case in point. I had all the whole. I just went across the board. I had it. I had it all. I still do have it all, but I just know how to manage it. And so, women going through that, it makes it difficult to go on about your business like you would like to. And so, when you're going through this menopause journey, you just need to know that you're not alone. That's one of the biggest things. You're not alone. Many women are going through this, and it's a thing that women just have to go through.
All those poor husbands out there having to deal with these menopausal women. What strikes me there, Juanita,
Yeah.
is the big difference in the time that it affects. So I can imagine, I'm 40 years old, so to me 35 is still quite a young age.
It is still young.
I can imagine being a 35-year-old woman, that could be quite daunting and scary. It's not pleasant at 55, but I think at 55 you're kind of expecting it. But I think for a 35-year-old woman, what guidance and support do you have for people at that age, or any age, that could be going through this kind of issue?
Okay, the first thing is, yes, 35 is young to start going through this. But the first thing you need to know is that you're not going through this alone. There are other women going through the same thing as you. Of course, sometimes that's not what you want to hear, because you want to be able to help yourself. There are services out there. There are things that you can do that will help you relieve those symptoms. We can just simple things as having a fan. I'll give you an example. Right now, as we speak, I'm not sure when a hot flash is going to hit me. And because of that, I have this little trick where I actually have a little fan with me. And I just keep it there to help myself know that when that flash comes along, it won't discombobulate me and get me all flustered. Always just be prepared. And being prepared there are many ways that can look like. You can read a lot of literature on it. You can get service from somebody, speak to your provider about it, or speak to other people, other women going through the same thing. And so the sense of community is also a very, very important thing when you're going through this. Because when you feel like you're an island, you're sitting alone in this volcano, so to speak, it's very daunting. But if you know that there are services and there are things that you can do to help you go through this, relieve some of the stresses that come with it, then it's helpful. And I know for the younger, again, we're all young, because I still feel I'm young. For the younger ladies, sometimes it can be really difficult, especially if they're still trying to have, bear children.
Yes.
That can be a very difficult thing to realize that, oh my goodness, maybe my chances of having a child are not as good, and they may not be as good. Doesn't mean you cannot have children. You still can have children if possible. And so there are ways, things we can look into, and to help make this something that's possible and be able to live with it. So yes,
I think it's great work that you're doing, and people out there definitely need that kind of support. And you're a doctor and you come from a medical background as well. We have quite a successful celebrity out here. I believe it's Davina McCall, her name is, and she went through a really traumatic menopause. and she started taking medication, but she's a big advocate now of talking about it, being an advocate of it, and saying how the medication really helped her to control it and feel better. What are your views on the medication side of the menopause?
Okay. And that's a very good question. Thank you. Now, as a pharmacist, that's what I deal in, medicines. And so it's almost like ironic that I'm talking about. The way I like to look at menopause is to help balance your hormones naturally before we go into the.
Yes.
I have no problem at all with medication. Again, that's what I live with. That's what I do. However, I am not a proponent for a pill for every ill. It's not always a pill for every ill. I want to look at things we can do before we go into taking medication. And medication out there is wonderful. There's a lot of medication that we could take. But if we can try and relieve the problem from the inside, because
Yes.
many times medications will cover the surface, and then they don't really take care of what's inside, what's underneath, and that's not all medications, but some medications. And then you have side effects from those medications, and you have to treat those side effects with some other medication. So if we can first deal with the issue from the inside out, then we can see how we can move on to medications if that's what's necessary. And again, I've no problem with medication at all. It's what I do, but I just think natural ways to look for relief are the first go-to.
That makes sense. And how long have you been doing this, Juanita?
So as a pharmacist, I've been a pharmacist for over 20 years now. And but working with women going through menopause, that's been about 2 years now. And I was doing it before, but officially, and to say that this is what I want to do, work with, look into working with women with menopause. It's been a good solid 2 years, which has been so much fun.
I bet it gives you a lot of satisfaction, doesn't it?
Yes, it does. Yes, it does. And because I'm going through it with them, it's something that I'm very familiar with. It just makes it even better when you see somebody coming out on the other side and like,
Yes, you're making a lot of women out there very, very happy, Juanita. Juanita, we just need to go to a commercial break. Please stay where you are. Thank you, everyone, for joining us for part one of Brilliance Business TV, conversations with leading experts in business. We're in conversation with Dr. Juanita. We have been talking all about women's menopause. Stay tuned.
thank you.
Hello, this is Stephen Buckner, and just wanted to tell you I support the Dreamweaver project. It's a great project where, artists such as myself will be able to come together and basically collaborate and to have a retreat to feel accepted and welcome. And that's something that artists here and around the world could always benefit from. So I just want to say, please support the Dreamweaver project. I think it's for a great cause, and I salute all the independent artists out there and artists that are signed as well. And have a wonderful day.
Welcome back to Brilliance Business TV, conversations with leading experts in business. We're in conversation with Dr. Juanita Bukenya. Welcome back, Juanita.
Thank you. Thanks for having me again.
So could you share with us the kind of clients that you serve and the products and services that you offer your clients, Dr. Juanita?
Okay. So I work again with women going through menopause. However, I don't, I make sure that when we work together, we both my client and myself are able to get along well. So
Yes.
I want women who know that this journey takes time. It's not a quick fix situation. Like many things in life. So I like to work with women who are ready to take on the challenges of of um, of menopause and know that they're going to have to work and not work hard. I mean, but just be able to put their minds to it to be able
Yes.
to get a change within themselves. So I work with again mainly women. Anyone going through the menopause journey is welcome. And I have a few different programs. I do some group coaching because sometimes people just want camaraderie to be able to talk to other women going through the same thing. Then I also do private one-on-ones because some people want to do their own thing, just the client and myself. And I do have a few programs that are 3 months to 6 months, and it depends. It depends on how the journey is going for you and what symptoms and what situations you're going through at the time. Because I address what is specific to you, because not everybody's going through the same thing at the same time. So my programs are always structured to the clientele at the particular time.
That's great that it's all tailored, Dr. Juanita, because it's not just one size that fits all. You can tailor
Correct.
it around them. And could you just share a little bit about the methods of your coaching style as well?
Okay, so I do enjoy um, humor. I like humor. I like being happy. So I want to be able to, when I'm doing my coaching, for you to feel free, to feel comfortable, and once in a while I'll throw in there a little bit of humor. And but what I normally do is I like this, just like I'm talking to you right now. I want you to be able to see how I feel, and I want to be able to see how you feel. And so it's usually always virtual. And this is the world that we're in right now. There's nothing we can do about that.
Yes.
Before I used to be able to do one-on-ones physically, but now I don't do that at all because again, this is the world that we're living in, and it works just as well with the virtual space. And so that's what I normally do. Um,
The power
Working.
of digital media, virtual reality. And it's great because then you can help people on a bigger scale as well,
Correct.
Juanita, in any
Correct.
different country, which is
Exactly.
great. How
Yes.
do you continue to learn and stay on top of things in the role that you are in?
It's this is a continuous learning environment, and being in the medical field, things change all the time. And when I was younger, I remember seeing this thing that said, "Knowledge is power. Information is how you get it." And so I am always, reading on the latest literature, watching the experts, because there are experts out there that I listen to and I enjoy. So I listen to them and try and do a lot of certifications that come up. So I'm always on top of um, of my trade because I want to be able to give the best and most improved and most current information. So reading and studying and listening. That's
Personal and
that's the main thing.
self-improvement is a way to grow and expand and to serve others. Dr. Juanita, there may be people out there watching, a lot of women who may be 35 just starting their menopause, or someone
Yes.
55 frustrating because they are feeling that they're not young anymore because of the menopause. Could you just share 3 of your top tips to support them through the what they're going through?
Okay. So one of the first ones I know, and I love to tell women, is just let it happen. Like, let it be. It's something that's happening. Let it happen. Now, that goes into my number two. Because it's happening, let's find ways to be able to help you. For example, if someone has trouble with sleeplessness, why are you having trouble with sleeplessness? Is it because you're on your device till the end of the evening? Or is it because you're not getting enough, you're not hydrating enough? So let's figure out why you're having this problem. For example, if you're staying too late on your device, how about you take off your device for about 15 minutes before you go to bed?
Yes.
Get everything all in the natural light and turn off devices. If you have a good book to read a book, but take off any device. See how that might work. And it's little baby steps. I don't want to tell you don't have any devices for an hour every day for the next 7 days. Start off 10 minutes. The next day, maybe 15. And let's see, before you know it, it'll become a habit. They say 21 days makes a habit.
Yes, very
Yes,
true.
before you know it. And also, the next, my third tip is community. Don't keep it to yourself.
Never suffer
No,
alone.
never suffer alone. Don't suffer alone. And remember, just know that there are people out there who will embrace you. So don't feel like you're alone. Open up and let us help you. Let us help you.
They are great tips, Dr. Juanita, and I'm sure someone out there will have needed to hear that. What is your most significant achievement to date?
I know this is gonna sound so cliche, but being a mom. Being a
Oh,
mom has been an amazing, amazing journey. I started being a mom late in life, over 35. So it can still happen. So it's just been an amazing thing being a mom to my two young children, my little boy and my little girl, they're 11 and 12. And also the fact that my son is on the autism spectrum. That also hasn't been easy, has not been an easy journey. And so going through that, and then also going through this menopause journey and all that, working, and it's been a lot. But every time I think about my children, it just brings me happiness. And I feel like I have done, and I still am, putting my all in being the best mother ever. And so I feel like for me, that is been the most significant achievement in my life. And I also saw that from my mom, who is an amazing mom. And so
that's
it's been a
beautiful,
great thing.
Dr. Juanita. Now, you are offering a free ebook and a complimentary consultation.
Yes.
Just share a little bit about that, Dr. Juanita.
Okay, so the free ebook is just talks about nutrition, what you can do um, on your journey, and just to keep you fit and to keep you alive and feeling vibrant. And the complimentary consultation, that one will be about like a 30-minute consultation where we talk about what you're going through and whether you and I are fit for us to be able to continue working together. Or if not, I'll give you resources that'll help you to move forward. So the consultation is just not only to see if you and I can work together, but if there's anything I can do or point you in the right direction to go to be able to help you on this journey that we are both going on.
I would say you have nothing to lose, everything to gain. If you're going through the menopause, you have met Dr. Juanita today. You can tell she's very approachable. You have nothing to lose. So grab your free ebook and complimentary consultation. Email Dr. Juanita at Dr. Juanita Bukenya RX.com. That's Juanita at Dr. Juanita juanitabukenya@drjuanitarx.com. I'm going to say it once more. Email Juanita at drjuanitabukenya@rx.com. I'm quite impressed that I even pronounced that so correctly.
Yes, you did. And also, they can find me on Instagram as well. And
Yes,
I'll
they
keep it
can
there.
follow you on Instagram at Dr. Juanita Bukenya. That's at Dr. Juanita Bukenya, at Dr. Juanita Bukenya. Dr. Juanita, I really appreciate you coming on to the show today. I feel it's a different topic. Some women don't like to talk about it. It is a little bit taboo, and it's great that you're sharing your message, and I thoroughly enjoyed having a conversation with you. Thank you.
Thank you so much for having me. This is a wonderful forum that you have on here to be able to help a lot of people. So thank you so much for
The
having me.
pleasure's all mine, Dr. Juanita. Thank you everyone for watching Brilliance Business TV conversations with leading experts in business. Today we have been in conversation with Dr. Juanita. We have shared how to get through the menopause. Until next time.
Thanks for listening to Business Innovators Radio. To hear all episodes featuring leading industry influencers and trendsetters, visit us online at businessinnovatorsradio.com today.